Hello everyone, Jim Kim here again. Please check out our new website, intuitiveanatomy.us. It has free tutorials, free practice questions, and I mean hundreds of practice questions for beginners and med students. And if you want to contact us, you can also do that on the website. Please go check it out and share with others. And without further ado, hello everyone, Jim Kim here again. And today we have an exciting topic to explore, the pelvis. It's not just a simple bowl-shaped structure, because it plays a vital role in supporting our upper body and houses numerous important organs and muscles that we'll be going over today. So let's dive right into the anatomical features of the pelvis. Removing the skin and locating ourselves to the pelvic area reveals this connective tissue called the pelvic fascia, which are these gray connective tissues that line the pelvis. And here you can appreciate that the pelvic fascia basically forms an outline of the pelvic area that we'll be discussing today. From here, I'm going to add some other structures. And removing the connective tissue first reveals your bladder. This is being shown right here. And this is where your urine gets stored until it's ready to be excreted through your urethra, which I'm highlighting right here. External orifice of female urethra. Right above it is the uterus in females, which is part of the female reproductive organ and almost resembles the bladder, but it sits on top of it. And looking at it from this specific angle shows that it's actually angled towards the front, which I'll be explaining soon. Posterior to it is your large intestine, specifically the rectum, which is part of the digestive system, which I just added into the model here. And removing the digestive system helps you appreciate that angle that the uterus is forming. And it's angled this way because it allows the uterus to expand during pregnancy. And imagine if the uterus was actually pointing up, then it'll be expanding towards the thorax. This lodging the intestine, stomach, liver, your heart, and possibly the lungs. So the angle of the uterus is very important during pregnancy. From here, let's now look at the arterial branches that supply blood to the pelvic area. So there's your abdominal aorta, which divides into the right and left common iliac artery, which itself then further divides into the external iliac artery and the internal iliac artery, which is being highlighted right here. And the internal iliac artery is the major branch that supplies blood to the pelvic area. The internal iliac artery then divides into the anterior division, as being highlighted right here, which supplies blood to your obturator muscle, your umbilicus, vagina in female, and bladder in males. And you can see the arterial branches, those minor branches coming off of the anterior division. Right above it and slightly posterior to it is the posterior division, which supplies blood to your vertebrae bones that line the spine, and it also supplies blood to your gluteus muscles that are on the buttocks region of your body. As blood circulates through the pelvis, it is drained by the pelvic veins, which have identically named branches, like the common iliac vein, which drains into the inferior vena cava, and inferior vena cava then drains this deoxygenated blood into the heart, as being shown right here. So pretty straightforward, and there are a lot of parallel branches between the veins and the arteries in the pelvic area. Now let us discuss the nerves of the pelvis. So here are the nervous systems of the pelvic area. And first, I want to focus on the sacral plexus, which receives innervation from S4, S3, and S2 sacral nerve. And all the other sacral nerves, as well as some of the lumbar nerves, eventually merge to form the sciatic nerve, which we already went over in the perineum video, and I highly recommend you to check out that video. It's one of the densest and one of the biggest nerves that you'll encounter during your anatomical dissection sessions. And right next to the sacral plexus is your inferior hypogastric plexus, which receives innervation from the hypogastric nerve, and the hypogastric nerve is responsible for providing innervation to part of the digestive system, like the sigmoid colon, as well as your bladder, prostate in males, and vagina and uterus in females. Also note that a lot of the structures present here are innervated by the autonomic nervous system, like the pelvic splanchnic nerve, which I'm highlighting right here, which comes from the chain ganglia, which I'll be going over pretty soon. And the pelvic splanchnic nerve provides the parasympathetic response, whereas the sacral and the lumbar splanchnic nerves, which I'll be showing right here, being highlighted right here, provide the sympathetic activation and the sympathetic response. And here you can see the ganglia, which are these dense bodies of cell that are found along your chain ganglia, and they are the most important components of the splanchnic nerves and the autonomic nervous system of your body. And just to recap, the autonomic system is divided by the sympathetic and the parasympathetic system. Sympathetic activation leads to your body's heart rate and the respiration rate to go up with more blood and red skin tone on your body, whereas the parasympathetic responsible for relaxation. So lowering heart rate, lowering respiration rate, and helps you digest better by activating the smooth muscles along the digestive organs, allowing peristalsis, basically a movement of food you ate down the intestine. Last but not least, I want to highlight this nerve here that I didn't cover, which is the nerve to levator ani. And levator ani is basically a group of muscles that form the pelvic floor. It divides the pelvis from the perineum. And you can appreciate the different muscles that make up the levator ani from this inferior view. Here I'm highlighting puboanalis, also known as puborectalis. Lateral to it is the pubococcygeus, and most lateral is the iliococcygeus. So again, puboanalis, pubococcygeus, and iliococcygeus. And here is just another view of levator ani, aka the pelvic floor muscles, and I'm highlighting the nerve to levator ani on the left side of the body. And that's basically all the muscles that I'll be covering for this video. Again, very superficial, with an aim to provide an intuitive understanding of the pelvic area rather than a detailed anatomical understanding required for medical school. And that's basically it. To sum it all up, the pelvic area houses a lot of muscles and organs that distinguish itself from the perineum and the abdominal system. If you enjoyed the content, please leave, like, subscribe, and share with others. And again, please check out our new website. Have a good day or good night. Bye-bye.